Omicron, the good, the bad, and the ugly. Actually, I meant to say Merry Christmas, but instead I'm going to talk about Omicron. Hello, I'm Dr. Sam, this is Dr. Sam's Health. Today is Christmas and I would love to talk about Christmas, but I feel like I should talk about Omicron and about the pandemic, the state of the situation right now, for several reasons. First of all, I already started talking about Omicron approximately a week ago when I said that in my amateur epidemiologist opinion, this variant of the virus will be something that will get us out of this situation because it's has low virulence, it's very contagious, it spreads fast, and hopefully it will push out the rest of the variants that are much more virulent out, and hopefully we'll all get our natural immunity and we'll live happily after. It's been a week or so and I've been monitoring the statistical situation, the epidemiological situation, and I'm surprised with the messages that we're getting from mass media, from scientific tables. It's all doom and gloom, and in my opinion it's very one-sided view of the situation. I have to talk about some positive aspects, and I would like to kind of describe the epidemiological situation, at least in Ontario where I live and work, and express my hopes again. Having said that, I have to make my regular disclaimers. Disclaimer number one, I'm a practicing physician, but I do not give any kind of medical advice over internet, on YouTube channel, or on my website, drsamshealth.com. Check it out, by the way, for my blog. I am not a professional epidemiologist. I do know epidemiology, I think. I've published quite a few epidemiological articles, but I'm not I'm not making money of epidemiology. I am just a scholar who taught himself a lot of things, and I like numbers, and I express some opinions here, but these opinions do not necessarily represent the opinions of real epidemiologists, the ones who are being paid for doing epidemiology, and my opinions are just my opinions that do not necessarily represent the opinions of my governing bodies, my universities, colleges, my specialty, psychiatry, and so on. Also, I apologize for the way I look. You might notice that I look kind of tired and worn and my shirt is all wrinkled. It is because I have spent the whole night being on call at the emergency department, and I couldn't make this video earlier for that very reason. It was actually a very odd shift, but nevertheless, today, on Christmas Day, I would like to make this video about the pandemic, and also there might be some noises because my cat literally and really missed me because I was away for a pretty decent amount of time. So let's get to the statistics, and from the get-go I will tell you that the statistics are not as bad as you might think if you just follow mass media and just listen to all this people who are conveying the information to us. First of all, yes, we do have a huge surge in cases in Ontario and I guess worldwide in general. And we have heard about these predictions, and we have heard that, likely we would have around 10,000 cases in the coming weeks. We do have close to 10,000 cases. I think that on December 23rd we had around 9,500 cases. And the major problem with that was that people were talking about the low virulence of this virus, and the whole mathematical conundrum was, say this virus is 50% less virulent than the Delta variant, but given that we'll have 10 times more cases, we will have way more severe cases that are requiring hospitalization, ICU, and so on, and we would not be able to handle it. So what our system shows, and I'm pointing at my monitor, I've got some data there. We've got certain nice epidemiological tools that are available to the public. I will make a reference to them in the description to this video, but I've just downloaded some CSV files and I'm processing them. So what we're seeing is, first of all, yes, we do have a huge surge of cases. We had close to 10,000 cases per day yesterday, the day before yesterday. But the good thing is that the number of hospitalizations is not growing exponentially fast, as well as the number of deaths. So my assumption would be that the Omicron variant is spreading so fast that is literally pushing out all the other more virulent variants, and accordingly it leads to way less hospitalizations and way lower mortality rate. Unfortunately, I don't have good data for hospitalizations just because all I have access to is just publicly available data, the data set, and this data set is a little bit complex. They tend to compound certain things, and I'm not sure if the data I can kind of deduce or calculate based on this data set are accurate, but what I can tell is definitely the rate of hospitalizations per 1,000 cases or per 100,000 cases is significantly lower than it used to be, which in my opinion indicates that the virus is less severe. Again, I will make this kind of disclaimer or note here that the data that I have are very incomplete. The solid data that we have, data on mortality, the number of deaths, and people are talking about number of deaths per day, but most commonly what we see in the news is like Ontario hitting the 10,000 death mark, and I think it's very unfair representation of death rate or death numbers because it is just fear-mongering. We have 3 pandemics effectively. We had the wild variant, then we had Delta variant, now we got Omicron variant, and these cases, these variants, the statistical and epidemiological situation is very different. So they are merging cases and death from way before Omicron with Omicron right now, and it doesn't do justice to the data. What we have right now is 6, 10, 12 deaths per day. Just in the past week we had one day when there were 0 deaths in Ontario, which is amazing. And we can compare it to something like a year ago, I think it was mid-November, when we had mid-November 2020, of course, we had 100 deaths per day, and compare that, and I think that you will see that the comparison is drastic. So what we have right now is the reduction of case fatality rate from 1.52% a year ago to something close to 0.1%. And I know that some people will hate me for this, but this is a mortality rate, case fatality rate, that is typical for a regular flu. And I don't want to draw too many conclusions from that. I hope that this tendency will continue. And in my opinion, it's a very positive trend. I'm very hopeful, again, that this Omicron variant will be our way out of this pandemic. The last thing I would like to talk about is the vaccination. A lot of people are talking about vaccines, about 3rd shots, 4th shots, endless number of shots, and how important it is to keep everybody vaccinated. As a scientist, I must say that the data indicate that it's likely not the case. Actually, just to be very transparent, I had my 3rd shot done a couple of weeks ago, and despite that, I've been reviewing the data. And a couple of weeks ago, the rates of infection among vaccinated and unvaccinated were significantly different. People who were unvaccinated were way more likely to get the virus. These days, and I'll show you the chart that is publicly available on public website, these rates are exactly the same. So it shows that likely our current vaccines are not providing us with a good immunity against Omicron variant. And I'm not saying anything bad about vaccination in general, but I think that these current vaccines are quite frankly outdated. They need to be adjusted. They have to change the genomic sequence in these vaccines in order to provide us with proper vaccination and immunity. Nevertheless, with vaccines or not, my prediction, we can call it educated guess, but it's not a professional epidemiologist guess. Given the high rate of spread of this virus, we all, or vast majority of us, will get Omicron variant within the next several months, and I hope that we'll all recover from it without any significant symptoms, and we will develop some sort of a natural herd immunity, with vaccines or not. If somebody develops vaccine that is helpful, I'm very happy for them. I will consider getting another shot. Having said that, that is pretty much everything I wanted to talk about. I feel that many of us pretty much do not have Christmas spirit. just because of this pandemic taking its toll on us. And as I said, I've been on call last night. I didn't like the feel in the hospital, quite frankly, and I know we got shortage of nurses, shortage of all medical personnel, and I didn't see too many people who felt Christmas, right? Nevertheless, I felt that it would be very important to actually talk about this virus, talk about Omicron, and talk about it in a more positive way than people normally do it on any kind of mass media platforms. And I see the light in the end of the tunnel. I see hope. So, having said that, Merry Christmas to those of you who celebrate Christmas, and just happy holidays to those who don't. I personally do, though I'm not even Catholic. I will spend this day recharging, resting, and editing this video. And thank you for watching. Hit the like button, subscribe, hit the notification bell not to miss a thing. And I promise you some more videos about COVID, about health, nutrition, weight loss, and obviously check out my website, drsamshealth.com. I've got my blog there, some materials for you. Merry Christmas, happy holidays. Thank you for watching. All the very, very best.